Hey, gorgeous. Welcome to Season 2 of the Hormone Puzzle Podcast. I'm your host, Coach Kayla Smith, CEO of the Hormone Puzzle Society, a women's health hub for fertility, hormones, and the business of coaching, creator of the Hormone Puzzle Method, an infertility warrior, two-time boy mom, and women's health expert. This podcast is for women struggling with infertility, painful periods, terrible PMS, or really just any symptom of hormone imbalance that they are ready to eliminate for good. Tune in weekly as we interview amazing experts in the fields of women's health, breaking down those hormone walls, nerding out on nutrition, and having way too much fun. Whether you're beginning your journey or you've been struggling for years, we're going to finally help you put those pieces of your hormone puzzle back together so that you can get pregnant and eliminate those pesky symptoms for good. Are you ready? This season is packed with even more expert guests sharing groundbreaking knowledge, giving you that jolt of energy that you so desperately need, sending you lots of virtual hugs, and inspiring you to take your fertility into your own hands and make that baby. Thank you so much for tuning in. Now let's get started on your road to transformation. Today's guest is Dr. Justin Houman, who is a urologist and fellowship-trained male reproductive medicine and surgery specialist, whose practice is focused on men's health, including male hormone management, sexual and erectile dysfunction, male fertility, male incontinence, and Peyronie's disease. As a minimally invasive microsurgeon, he specializes in microsurgical procedures and conditions. Dr. Houman's practice is centered on enhancing men's quality of life through hormone management, improving sexual function, and achieving reproductive goals. On today's show, we talk all about male fertility, ED, and things that you can do to optimize your fertility in your 20s, 30s, 40s, and beyond. Without further ado, I would love to welcome Dr. Houman to the show. Hey, Dr. Houman, welcome to the show. Thanks for being here.
Of course. Thank you for having me.
Sure. So let's get into a little bit about your story. How did you begin working in men's health and with ED?
Yeah. So, I'm a urologist by trade. So I did a residency in urology, and, during my urology residency, I noticed there's this huge gap in terms of, young guys being seen by their doctors. And the main reason why young guys were being seen by their doctor was a lot of it was either they're having problems with their erections or any type of sexual issue, sexual dysfunction, or infertility. So, that huge gap is really well addressed with men's health. So I did a fellowship in men's health, looking into sexual dysfunction, male infertility, hormone issues in men. And yeah, it fills that niche. It's nice. It provides young men with the opportunity to seek out a physician to address a lot of their issues. And it really, helps improve their quality of life from a sexual standpoint, reproductive standpoint. So it's great.
For sure. And I feel like not a lot of men are talking about men's health. And I feel like it's a hugely overlooked, issue in our healthcare. So why do you think that is? Why do you think we're all focused on women's health and not so much with men?
Yeah, great question. So, this is the big thing. So a lot of times, typically, a 50-year-old guy the first time a man sees his doctor, maybe in their 50s. And at that point, they may have chronic diseases, whether it's diabetes, high blood pressure, high cholesterol levels, what have you. But what men's health does is it gives guys the opportunity to seek out a physician earlier on to address some of those issues. So let's say you have diabetes in your mid-30s, rather than waiting 10, 20 years for this to become a chronic disease, something that's caused significant impact on your blood vessels. You seek them out earlier, and then you help address that diabetes earlier on. And again, the reason is because a lot of these issues, the first sign of diabetes, high blood pressure, high cholesterol, a lot of times it's poor erectile function. So, what I do is we help, as a men's health specialist, they come to us initially, and then we do the whole workup, and we make sure that everything is teed up from a health standpoint to make sure we're not missing anything early on.
Gotcha. And I find that, we're in a fertility crisis as well. Men's fertility is on the decline. I think I heard a statistic recently that said, it's 40% down right now, men's fertility. And it's just crazy. Why do you think that is? Why are we seeing all these issues popping up?
Yeah, it's an interesting question. I think for one, the fertility, that report that you're talking about came out a few months ago. It was talking about, there's a male fertility crisis. And I think, it could go both ways. First of all, male fertility, it's very poorly understood. The science of male fertility is very poorly understood. So we haven't done a lot of good research on it. To compare what we have now, where male fertility is now, we don't know. We don't have good science to say where it was 100 years ago, but we do know that men are having kids at a later age, number one. There's more environmental things going on in terms of cell phones being in our pocket, laptops being in our laps, radio signals, everything around us. These things could affect the quality of testicular health. Now, it's the end of the world for male fertility? Absolutely not. Guys are still pumping out 20, 30 million sperm per ejaculate, and all you need is one. Right. All you need is one in order to fertilize an egg. So we're doing okay in terms of, guys are still, they're still producing good numbers of sperm. And, where are we going with this? How bad is this trend going to be? No one knows. But I think in some ways that fertility crisis, it's not so much of a crisis. It's just something that we have to be aware of. I think, that alarm that was sounded a few months ago may have been a little bit, premature.
Well, that's good news. Yes.
Yeah.
And I work with a lot of women and they always ask me, do I need to get my partner involved? And I'm like, yes, it's both of you are making this baby. So we need you both involved. So
Exactly right. Exactly right. Yeah. It takes two to tango.
Exactly. Yes. So talk to me about low testosterone. How common is this and how do we know that we even have it, or how does a male know he even has it?
Yeah. Great question. So testosterone is huge, right? It's the male hormone, right? So what make men feel like men in a lot of ways. And guys typically they start to lose their testosterone starts to go down at the age of 30. So typically your testosterone levels start to go down by 1 to 2% every year after the age of 30. Now some guys it's a little more than 1 to 2%. Some guys it's less than that. But having low T is very, very common. And the main symptoms really associated with it, fatigue, poor energy levels, not exercising the same way you used to, not sleeping right, your mood's not the same, you don't feel satisfied with work, you just don't feel like the same person you are. And the beauty of it is it's a simple test. How do you check if you have low T? Number one, you have to have some symptoms, or number two, you just do a blood test and we can see what your total levels are. Typically, we like to do it in the morning to see that's when your testosterone levels are at their highest. So we check what your peak testosterone levels are, and as long as they're depending on where they are within the range, we can make a decision in terms of whether or not you'd be a good candidate for testosterone replacement therapy. And there's various forms of that because, again, it's so common. There's so many different ways you could replete your testosterone levels. The key thing when it comes to testosterone, I have a lot of patients because I do a lot of fertility, is a lot of guys who are trying to have a kid, they have been put on testosterone replacement therapy. And the thing to remember is if you're interested in future fertility or current fertility from a male standpoint, being on testosterone replacement therapy is not a good move, or at least it kills your fertility. So there's other options in order to increase your testosterone without compromising your fertility for young guys. So seek consultation for that. That's the important thing.
Gotcha. And can we dive into that a little bit? Do you have maybe one or two things that we can holistically do to increase our testosterone?
Yeah. There's, the things you could do. These are the kinds of things you could do for good overall health, but sleep has a big, correlation with low T. So if you shoot for at least 7 hours of sleep a night. Vitamin D, zinc, these supplements are actually, some of the, if you're low on vitamin D, if you're low on zinc, those are correlated with low T as well. There's things you could do to improve them are compound muscle exercises. So bench press, squats, deadlifts, these types of, cardio is good for overall health, but not so much for testosterone levels. But compound muscle exercises in terms of weightlifting, those are good for where you get different muscle groups involved. Those are actually very good for increasing your testosterone levels. But at the end of the day, there's only so much you could do from a lifestyle standpoint to truly help your levels. But yeah, all those things are not just good for your testosterone, but they're good for overall health. So yes, definitely do those.
Perfect. So if we're having these symptoms, what I hear you saying is we want to see somebody like you, get tested, make sure that it is low testosterone. And then if we're younger, look at maybe doing more lifestyle. Obviously everybody should do lifestyle, protocol, but for the younger guys who might want to get pregnant, might want to have, don't want to compromise their fertility, then they really don't want to do the replacement therapy. Is that what I'm hearing?
Yeah. But young guys, the good thing is young guys, there's also a therapy that we can put you on that it's a medication that will improve your testosterone levels, but it won't compromise fertility the same way testosterone replacement there, same way the injections, for example.
Gotcha.
The injections will kill your sperm production temporarily, but
Gotcha.
yeah, you won't be able to have kids during that time.
Cool. Okay, perfect. Well, let's switch gears a little bit and talk about something that I get asked a lot, COVID and the COVID vaccine. How is this, do we know if this is affecting our fertility or our erectile, dysfunction or any of this?
Yeah, so this is it's interesting because there's been a lot of data on both sides of this. So when it comes to COVID and erectile function, right? So the COVID virus itself, we do know that the COVID virus itself has some impacts on just everything, from heart health to penis health to testicular health, what have you. And the reason behind that, the main reason behind that is because it increases, when guys get really ill with it, their temperature goes up, right? They get those fevers. And during that time where they're getting their fever, the testicle is not functioning the same way it used to. So you could have a transient, like a temporary decline in your testosterone level, which could affect a lot of things, your energy levels, your libido, your erectile function, those types of things. So that COVID virus itself could have a transient, a very temporary effect on your libido, erectile function, energy levels, right? Mm-hmm. Now, does the COVID vaccine have any impact on this? So I've had a lot of patients who they came in, they wanted to be evaluated for fertility before they got the COVID vaccine. Mm-hmm. They went and banked sperm, and everyone who has come in, it's about 15 guys who had come in to bank their sperm. And when you compare their semen analysis before versus after, none of them had any difference in terms of their semen analyses after they got the vaccine. Now, it's a small sample size. It's only a few guys, but from what, my experience, the vaccine hasn't impacted male fertility at all.
Good. Well, that's good to hear for sure.
Yeah.
So let's talk some myths. What are some myths that you hear around ED, and can we debunk some of those?
Yeah. Have you heard of any common ones?
I haven't. That's why I'm curious. I wonder if there is any, maybe this isn't something that can be fixed, or, this is just something I have to live with, is any of that true?
Yeah, I guess so. So one of the main myths is, that, so it's not curable, right? So erectile dysfunction is not curable. So, I'll say this. So if you're a young guy that is experiencing erectile dysfunction, right? So by young, let's say in your 20s, for example. So it's pretty common where like a college student, even in their early 20s, comes in, they've had a night out or let's say anybody in their early 20s where, let's say you had a night out of drinking and you're trying to sexually perform that night and you're not able to because of, a lot of it's due to the alcohol. Your stress levels at that point, or you remember that incident, right? Then the next time you're trying to have intercourse, you remember that, right? You remember that incident, and sex itself and having an erection is a very stress-free process. So if you have any cortisol, any stress hormone in your body during that time where you think about that previous incident, your erection goes down, right? Or at least it's not as strong as it used to be. And then the third time you try to do it, you remember that the first and the second time. And it's like this vicious cycle where every time you just think about it. So this is very, very common. I see a handful of patients every week who are experiencing this, like we call it psychogenic erectile dysfunction, where the machinery works. Their hormone levels are great. Blood flow to the penis is great. The nerve conduction, all that works fine. Physiologically, they're in great shape, but then the mental aspect is still there. And there's things we could do to help alleviate that mental aspect. There's things we could do. There's a protocol I put young patients on that allows them basically allows them to reassure themselves, build that self-confidence in terms of having a good, strong erection. And it's only, you're doing this for 3 to 6 months, and then they're able to come off any types of medications that we put them on. So in that sense, erectile dysfunction is curable. For young guys who have psychogenic ED, there is good options in order to treat that.
Awesome. Awesome. And I talk about this a lot on this show. Mindset is huge. And I find too, sometimes just the stress of trying to make a baby can cause some ED. So it sounds like that's a little bit of what's happening. Maybe, your wife's pressuring you, your partner's pressuring you, and you're like, I can't perform. And so then you have a little bit of that, that type of ED. So yeah, I could see that.
That is a great point. That is super common. Trying to perform while having a kid, it's huge. It's huge.
Yes.
Yeah.
So how do we get around that?
That's a great point.
Yeah. Do you have any tips for that? Just some mindset tricks around, being able to perform when we want to have a baby?
Yeah. There's some therapies we could put you on. Some of it's pharmacologic, where we're able to help induce or help, create a good, longer lasting erection during that time. It just gives you a little bit of a boost because these guys aren't coming in with, 0 out of 10 erections. Their erections are probably 60, 70% of what they were before. So all they need to get is, 30, up to 100 or 90 to 100%. So there's different pharmacological treatments that we could put them on in order to, just during that time, in order to relieve that stress and get them through it. Some of it's Cialis, sometimes it's Viagra, these agents that help create stronger erections. But yeah, it's common, and the good thing is we have options for this. So it is very, it's generally easy to treat, that type of, erectile dysfunction.
Awesome. Yeah. One of my favorite things to recommend is just, let's forget about making a baby. Let's go on a date. Let's have some romance and then have sex because we want to, not because we're trying to make a baby. And usually, sometimes that'll fix things.
Right. You just got to reduce anything that could reduce the stress or the anxiety associated with it.
For sure. Well, awesome. So we're going to take a quick break to hear a word from our sponsors. We're going to come back, and I want to dive into more practical tips around optimizing male fertility and overall health. So we'll be right back. Hey y'all, it's Coach Kayla here. I hope you are loving this episode as much as I am. We will be back in just a minute, but first, a word from our sponsors. Today's sponsor is Daddy. Because infertility is such a huge problem for guys, and your sperm count decreases with age, Daddy is on a mission to make the process of fertility testing and sperm banking comfortable, convenient, and affordable. No visits to a sperm bank, no masturbating in awkward rooms. Daddy has developed an at-home sperm collection kit, allowing you to collect in the comfort of your own home. Use the provided shipping label, schedule a FedEx at-home pickup, and receive a lab test fertility report the next day. These services at sperm banks usually cost thousands of dollars, but for $199, Daddy provides an at-home sperm collection kit, a lab-tested fertility report, and a free year of cryogenic sperm storage. We're providing you a special limited time offer here at the Hormone Puzzle for this community. You can get $25 off if you go to daddykit.com, and that's spelled DADIKIT.com, and enter promo code Coach Kayla at checkout. That's Coach Kela at checkout. Order your Daddy Kit today and make sure that your partner's sperm is optimized. Welcome back, Dr. Houman. Thanks for being here.
Thank you.
So let's talk some more practical tips. What are some things that we can do to be optimizing our male fertility?
Yeah. So, things that we could be doing, three simple things, right? It's all about eating right, sleeping well, and moving, exercising. So when it comes to eating right, there's no perfect diet, right? But generally a balanced diet. So when you think about that, we're talking about complex carbohydrates. We're talking about good fats, polyunsaturated fats. And then when it comes to protein, lean proteins. Now, no one's perfect, right, with their diet, but don't exclude any of those things. Just have a good balanced diet of those three things. When it comes to sleeping, as I mentioned earlier, at least 7 hours of sleep. And then when it comes to exercise, fertility is a little bit more dependent on, good blood flow, right? So how do you increase your blood flow is really what you want is, if you can, the key is if you could do 20 minutes of, essentially, cardio exercise every day. So if you get your heart rate to about 160, between 160 and 180 for about 20 minutes each day, or 5 days out of the week, that has good evidence to support, get good blood flow, and that could help testicular health. And with that, you're going to help sperm health.
Amazing. I love it.
Yeah. The other things, and these are the other things, is try to do whatever you can to protect the testicles. So radiation, toxins, those types of things. So reduce laptops sitting on the lap. Try to do whatever you can to reduce the amount of exposure that the testicles have to your cell phone in your pocket, for example. There's a lot of companies now, or there's a few companies that are creating linings, whether it's in their pants or whether it's with the underwear, that protects the testicles from the radiation from the cell phone. One of those companies is called Silver Linings. They help protect or reduce the radiation exposure that testicles get from the cell phones. And there's science to suggest that really cell phones that's sitting in the pocket could really impact the quality of the sperm, the quantity of the sperm. And this is something what none of us were really aware of. So these lifestyle things could definitely help you.
Interesting. And then is there any foods that we should stay away from?
Yeah, I mean, foods wise, there's nothing in particular that say that this particular thing is bad for you. But when it comes to, I guess it goes back to the diet aspect. Fast foods, fatty foods, non-lean proteins, those types of things. Just think about it. Those things that could thicken up your vasculature, decrease blood flow to the testicles. Those types of things could really have some impact. It's not, fully detrimental. It's not going to be a make or break, but they could definitely negatively impact the quality of the sperm.
Gotcha. And what about alcohol? I get that question a lot. Alcohol and coffee, how do those affect things?
Yeah. So coffee, I think this was years ago. I had read a study where they looked at caffeine actually helps with the sperm motility, right? Sperm motility is one of the aspects that we look at. You have to have a certain number of your sperm having to move. About 40% of them have to be able to be moving in one direction. Now, caffeine, as you can imagine, it's a stimulant, so it helps with sperm motility. Alcohol in some ways, it helps relax you. So this is the key, right? Where it comes back to the idea of everything in moderation. Coffee, everything in moderation. So, 1 or 2 cups of coffee a day is okay. Having 9 to 10 is probably not good for you. Same thing with alcohol. Having a glass of wine a couple times a week, having a beer a couple times a week, fine for you. Binge drinking is not. So everything really is in moderation. Cigarette smoking, not good for you, right? It's definitely not good for you. We do know marijuana, it kind of goes both ways. Hormonally, smoking a lot of marijuana is not good for you, but we do know that for some guys, it is an aphrodisiac. So it may increase the frequency of intercourse, so that could potentially help with your fertility goals if you're having sex more often.
Gotcha.
But marijuana kind of goes both ways.
Gotcha. Okay. And then how about any supplements? Is there anything that, maybe we've been trying for 6 months to a year, we haven't gotten pregnant, and we want to kind of supplement some of our diet? So is there maybe 1 or 2 that are your favorites?
Yeah. So, if you've been trying for 6 months, I would say at that point, you should, at the very least, do a semen analysis and see where, from a guy's standpoint, objectively see where your numbers are at. It's relatively straightforward. You could do it at home. There's some online services now that essentially you just do it at home. You send it to them and they give you a report. Or you could go to a fertility clinic. My clinic, there's the reproductive endocrinology on the female side. They have semen analysis machines there as well. Just get objective numbers and see where you're at. At that point, if there's anything faulty, if there's anything weak in terms of your semen analysis numbers, there could be an evaluation. And one of those things that we could do to help you is supplement. Supplement wise, there's companies out there. There's about 5 different. We do know there's 5 different vitamins and minerals that could help with improving your fertility. Coenzyme Q, vitamin E, to name a few. There's some companies that really just combine them all together. Other times, guys will buy each and every one by themselves. But that's, I would, before you get involved in the supplement game, what I would do is just make sure you have a normal semen analysis, or see what your semen analysis is, and then you could decide on what's going to be the best route for improving your semen quality.
Perfect. Yeah, that was my next question. Do we need to get a semen analysis? But it sounds like you're saying, yes, we do if it's been 6 months or more.
Yeah, at the 6-month time point, I would check. I would definitely check, without question, just to see where you're at, rather than keep delaying this, because the fertility game, it's a long game. And a lot of people, 6 months is a long period of time, to be trying. So if you're waiting another 6 months, you're burning daylight, because a lot of, more so women, but guys too, you want to do this earlier in life in order to make sure, that you're producing good quality sperm and good quality eggs.
Yes, for sure. And I always let my clients know, and my listeners, that it's a lot easier if it is the male issue to fix things. It's a lot harder when it's the female. So let's just rule that out. And if it's not the male, then we can, move forward.
Exactly.
Awesome. So talk to us about where we can find you. How can we work with you, and where are you online?
Yeah. So, my practice is located in Los Angeles, California, right by Cedars-Sinai. You can look me up online. I have a social media profile online. My name is Justin Houman, Houman. There's Instagram, there's Twitter. If you have any questions, feel free to reach out on any of those platforms and send a message. And we could set something up to talk. But, I'm just Houman. Look me up on Google and you could find out a lot of information on me.
Awesome. And we'll have all that in the show notes, so you'll be really easy to find. So cool. So any final thoughts, words of encouragement that you want to leave our audience with?
Yes. So for when it comes to men's health issues like infertility issues, sexual dysfunction, low testosterone, Peyronie's disease, what have you, they're all very, very common. It's the taboo subject for a lot of guys to talk about. It's a very difficult subject for guys to seek a consultation about. A lot of times their female partners are the ones doing it. But if you are experiencing these things, you're not alone. I can tell you. I see my practice is built on this. I see a lot of patients every week who are experiencing these same issues. So if you feel like you're alone, you are not. A lot of your peers, they're experiencing this. They may not be telling you that they're experiencing these things, but they are. And the beautiful thing is there's a lot of good treatment options for all of these that could improve your sexual quality of life, your energy levels, all of that, your fertility quality of life, all of it. So if you are having these issues, feel free to reach out.
Perfect. Well, thank you so much, Dr. Houman. It was so nice to meet you, and I really appreciate you being here. So thank you.
I really appreciate this too. Thank you for the time.
Yes. And thank you, ladies, for listening to the Hormone P.U.Z.Z.L Podcast. Until next time, bye for now. Hey, hang on just 1 second before you go. I want to make sure that you are aware of all of the amazing free resources that I have for you on my website at CoachKayla.com. From a fertility meal plan, a cycle syncing quick start guide, a holistic healing cookbook, as well as master classes, blog posts by me and some amazing experts in the fields of fertility, hormones, and nutrition. So many wonderful resources that will help you on your journey. And I wish there had been something like this when I was going through my 2 years of infertility, but there just wasn't. And so that's why I decided to create all of this for you. So make sure that you go and check it out and you take advantage of this plethora of support that I have provided for you. And spoiler alert, these were some of the same tricks and the same foods that I used to get myself pregnant, not once, but twice, even after my doctors said that I couldn't. So I know that these things work. Make sure you take advantage of that. And I cannot wait for you to be my next success story. So thanks, love. See you soon. Thanks for tuning in today to the Hormone P.U.Z.Z.L Podcast. Check out the show notes for today's episode at CoachKayla.com. If you like what you hear, please subscribe and leave a review. Thanks for hanging out with me, and I'll see you next week.